AI Scribes. Have you used them before? And do you feel like they are able to help reduce some of the workload?
When it comes to my workload itself, I'm really looking forward to using the AI Scribe. I think in general, for a lot of people, AI is something that they use to not only make their workload more easier, but using it for other things as well. So from a training perspective and how I use social media, I get to use AI to help with, editing if needed, with personal statements. So it comes in handy for a lot of different aspects of my life to make life easier.
Hey everyone, welcome once again to Medical Success Secrets. I'm your host, Theo Harvey, and I have another great guest with me today, Dr. Arti Patel. How are you doing, Dr. Patel, today?
I'm doing very well. How are you?
I'm doing wonderful. If you guys don't know, Dr. Patel is really immersed in social media and sharing her expertise. She finished her undergraduate education in Chicago and attended Ross University School of Medicine and is now a practicing family physician. When you kind of think about, social media, finding your voice and communicating, we talked about, AI and, technology integrating. I mean, as someone who sees a lot of patients, what tools and technologies do you feel are helping you become a better physician, right? I mean, we do a lot with remote care, like technologies providing blood pressure cuffs and scales to patients to help with their chronic condition management. But when you look at the way you practice medicine, what do you think can be more effective, as you kind of go down this path for the future of healthcare and its tools?
I think for me personally, using AI to kind of summarize a lot of research articles and publications and medical journals is extremely beneficial because unfortunately, if you work, 4 or 5 days a week, and to be honest, it's never truly an 8-hour day. It's at least 9 to 10 hours every day. Having AI summarize everything for you to at least get the main points and stay on top of evidence-based medicine and, reading on the updated statistics and knowing which medications are more accurate and, accessible to us as healthcare providers at the end of the day, I think is super useful because I will be honest, I don't have time to come home every day and read a research article. I would love to be able to at least get through one a week or one every other week, but it's just not feasible at the end of the day. And so I do think that AI has a lot of power in being utilized from that perspective. When it comes to my workload itself, I'm really looking forward to using the AI Scribe, as we talked about earlier, of course. And I think in general, for a lot of people, AI is something that they use to not only make their workload more easier, but using it for other things as well. So from a training perspective and how I use social media, I get to use AI to help with, editing if needed, with personal statements. So it comes in handy for a lot of different aspects of my life to make life easier.
As we're recording this, we just celebrated Labor Day weekend here in the United States. And so you didn't have time to read any journals on the day off at the beach or relaxing?
To be honest, I could have, but I don't see my family as often as I would like to. So I was just super excited to actually stay, I guess I would say, which is probably going to outdate us a little bit, but on the down low.
Yeah.
So I stayed away from social media as much as I could during this 4-day weekend and just truly spent it with my family.
Awesome.
And yes, when I did come back last night, I went through all of my emails and I opened up my work inbox and everything was flagged in red because I'm like, oh crap, I'm overdue on working on all of this.
Yeah.
But yes.
No, you got to turn it off. I get it. Yeah. Because we live in an always on society. That's the only problem with technology too, especially these smartphones. And, people can feel like they can assess you. I don't know about you, but I even use my phone now. I put it on do not disturb most of the day. So yeah, I can focus because it's a lot. But no, I'm glad you were able to have that time. Yeah, I mean, I think those are the future, where healthcare, where it's going and kind of using these tools. I like how you're saying summarizing articles. I mean, obviously I use it a lot to understand, where things are going because there's so much, right? There's so much research and so much information and new evidence-based content that you can kind of share with patients because ultimately it's about helping them. So you want to be the best physician you can be, I'm sure. And so looking at AI to help you with that is great. Tell me a little bit about some of the things that you're seeing out there, especially when it comes to physician burnout. There was a recent AMA report that says 60% of physicians experience burnout. Is citing lack of autonomy and overwhelming workload. How do you personally guard against that, and your well-being while you still service others?
Yeah, absolutely. So unfortunately, burnout rate is very high, especially if you're in primary care like me. Personally, for me, I try to set apart my work time and personal life and keep them completely separate. I do not believe in bringing my work home with me. I feel like that causes a lot more of a burnout burden for a lot of physicians. But unfortunately, in primary care, we're seeing so many patients on a daily basis that you don't have a lot of time to complete the administrative aspect of work. And so you do tend to bring it along with you at home to make sure you're staying on top of your workload if you're not actually efficient at work. And so for me, the biggest thing is efficiency. I truly love my patients and care for them, but I do try to be honest with them and tell them that we only have a limited amount of time per visit. And so I address their priorities for that visit. And this helps me take care of them and still, treat them with the same kindness and empathy that I've learned since I started training, and still being able to stay on top of my workload and making sure I complete all of my notes and administrative tasks before I leave for the day.
Absolutely, absolutely. Yeah, the workload obviously is expanding more and more, especially the frontline physicians, the internal medicine, practice. I know you see probably your share of patients. I kind of want to talk a little bit. We talk about technology and the interplay with physician workloads. Talk to me a little bit about like AI scribes. Have you used them before, and do you feel like they are able to help reduce some of the workload? I think there was a Stanford report that said these new ambient AI scribes who are actually documenting while you're looking face to face to the patient are helping to kind of reduce that documentation time by 60%. How do you feel about these? And is this something you're starting to incorporate into your current workflow to help you deal with the workload?
I haven't personally used it myself yet. We currently use the Epic EMR system at our clinic and in the hospital that I work at, and they are in the process. So they have the little AI button available, but it's not ready to go just yet. But I've heard a lot of good things about how using AI to scribe while you're talking to the patients has been extremely helpful for other individuals, mainly because you can physically talk to your patients and, look them in the eye while you're talking to them, which I feel like helps much more building that connection with them and making them trust you a little bit more while taking care of them and their health overall. And I do believe that, being able to have the documentation done while you're speaking with them would save a tremendous amount of time before you even leave the room. So that's definitely a pro. On the downside, I think it's very important to make sure that you don't just, complete your notes and your documentation without actually reviewing it. I feel like there's a lot of things that I talk to my patients about that they may not want documented in their chart. And that is based on, what they say. And if they don't want it in their chart, I personally feel like it's not my right of way to provide that information in the chart and have it accessible to other providers. And so it's very important to still take the time out, make sure you skim through whatever the note includes and delete portions out that should not be included in there. And so I am a little scared that I feel like a lot of people, if you get super caught up and busy and you're not paying attention, you're going to think that, hey, I have AI Scribe, my note's already done, let me just go ahead and sign the visit. And this can create a lot of other issues in the future, not just for yourself, but also for the patient. So definitely something to keep in mind overall.
That's a fair point. I think privacy is something that a lot of folks don't think about when it comes to technology. I mean, we've been dealing with this with the internet for years, but now with AI listening devices always around, or even putting things inside these AI chat bots, look, it's your health information, and now you're kind of releasing it out into the tech world, right, if you will. And so people think they're just talking to a AI chatbot and just keeping it between themselves. That's not the case. And you make a fair point. I think having to help continue building that trust with patients, physicians really have to take the time and kind of really, look through their notes. to kind of understand like, hey, the stuff that's really private that the patient only kind of told for me, that should be taken out so I can continue building that trust, because that's so important as patients are looking, to share a lot of things that they probably wouldn't normally share. And I'm sure it's difficult as it is to get them to share even that much, right, in that environment. So thank you for bringing that up. So it's so important, when you kind of think about how when you talk to patients, they suffer from a lot of chronic conditions like diabetes, hypertension. What are your thoughts about this lifestyle focused care, right? I know you have a limited amount of time with your patients there in the clinic, but obviously, you care for them. So advice are you giving some of your patients around thinking about a more lifestyle focused care plan?
Yes, absolutely. So it is something that I bring up with my patients every single day, whether it's my pediatric patients, middle-aged, or even geriatric patients. I think lifestyle modifications, eating healthy, exercising, makes a significant difference in their chronic conditions overall. And I personally, like to explain it in a way that it's the small things that will make a difference at the end of the day. I do not expect my patients to, do a full blown keto diet or go exercising every single day. But if they're able to, make one small change in their diet, whether that's like cutting out soda or being able to take even a 10 or 15-minute walk outside, that's what will make a difference at the end of the day. And I will continue to recommend that for my patients because a lot of patients don't like taking medications, and unfortunately, if we don't make those small changes in our life, then we have no choice but to be on medications. Like, that is the worst that we can get to. And I love being able to, cut out medications from my patients when they're doing well. And when I see that on their face, it only makes me want to encourage these lifestyle modifications even more. And they are also able to see that, these things are truly working for me. Why would I not continue doing them if that means that I have to take one or two less pills every morning? And so baby steps, small changes are definitely a big contributor to how well your health will be at the end of the day. And like I said, if you're honest with your patients and, explain that we all have cheat days, we as physicians also don't live a perfect life, I think it also makes them want to believe you even more and kind of agree to wanting to make those steps themselves.
I love that. We talk all the time on this podcast about the three T's of how to build trust with patients. Obviously sharing, your testimony. Being able to be transparent, like you mentioned, like sometimes having cheat days, and then ultimately you can build that trust with that patient. And so I agree. I think communication between the physician and the patient is so powerful, and sharing your background and story is key as well, especially as we move into, when you think about it, a lot of patients are, getting advice from physicians and other kind of work individuals across social media, and some of that information is inaccurate or quote unquote, wellness gurus and things of that nature. So kind of talk to me a little bit about, your journey on social media, right? I mean, I know you were a med student, and you were helping individuals, who were looking to get into med school. What makes you continue to kind of, just talk about, just in general, inspiring people about your journey from med student to now practicing physician? Are you open to kind of sharing that journey a little bit?
Yes, absolutely. So if you go on my social media, you will see that I wanted to be a doctor for a very, very long time. Of course, I didn't know how hard this journey would be, or even how long it would be for me to, get to the point that I am at today. And so being able to help out other individuals reach their goals was something that really appealed to me during the pandemic. I was sitting at home. I was still waiting to, start my clinical rotations. And I'm like, I want to do something more. And so I initially started a blog, and from there I realized that social media is much more active than just having a regular website that people can go onto. And so I kind of added the social media aspect onto it and realized that it's incredible how many individuals you can reach out to through just like TikTok or Instagram, and being able to connect with them, help them, and seeing them reach their goals is truly amazing. And I feel super grateful that I get to speak with individuals from all over the globe on a daily basis, getting to help them get into residency training and, having them come from other countries to practice in this country that they've always dreamed of is, I feel like I get to play a small role in that. And it makes it truly worth it at the end of the day, even though a lot of times it is more time consuming than I thought it would be. On a personal level, I feel like it's also just helped me kind of gain a voice and move out of my comfort bubble. I'm someone that is extremely shy. I'm an introvert. I get super nervous talking to people and just presenting, but on social media, I feel like it's a tad bit easier, because I'm not physically in front of these people. And so I get to help out in a way that lets me feel comfortable, but still a small step into putting myself out there on a daily basis.
I love that. That's so important. I mean, likewise, I was the same way. I mean, but just starting to do more and communicating more and having conversations with wonderful physicians like yourself, and just connecting with individuals that I normally wouldn't, has opened me up to their experience and lifestyle experience. I think, and that's so important to do it, and trying to help in a little bit of way, even though, could be some negativity here and there. But I think for me, at least, the positivity far outweighs any negativity that might come my way. So no, kudos to you to do that, and being out there more. Wow, this has been, super helpful, for my audience, especially for physicians who are just getting started in social media, or just thinking about technology and how it can be used, especially if they're just starting their journey. Yeah, where can, they find you, read up more about you, where, anything that you have coming up that you want to promote? Please, this is your time to kind of share.
Yeah, of course. So I do have my blog, and it's www.itsartipatel.com. And I have that same handle for Instagram and for TikTok. I mainly use Instagram, though, a lot more for educational purposes and being able to help medical students and residents at the end of the day. So I try to post a lot on a weekly basis, just to stay connected with everyone. In terms of new things, I don't have anything new coming up. Like I said, my page is more so about trying to find that balance of work and life. So I try to share work-related things, information related to medicine and getting into residency, but also a lot about my life in general, and showcasing that, even as a physician, at the end of the day, being a doctor is a part of my life. And of course, I absolutely love it. It took a lot of years to get here, but I do enjoy living life outside of work and being able to see my family and my friends and spending time with my husband and loved ones. Being able to showcase that, you can still reach your goals after all of these years of working hard, but you shouldn't feel guilty for enjoying time outside of medicine. We're still human at the end of the day. And so I always try to remind others of that when they do comment negatively, or, respond or send me messages saying that it seems like you have a lot of free time on your hands, and it's all about the balance at the end of the day.
No, definitely keep sharing, that you can do both. I mean, obviously. And so I think that's something that more people need to see. Because we're not robots, we're human beings at the end of the day. And so we all have our ups and downs, and trying to live this journey we call life. So, well, Dr. Patel, it was so exciting just to really talk to you and just get a sense of, how you just walking the walk and living the life as a physician, and dealing with technology, seeing your patients, and living a more well-rounded lifestyle. So thank you for this time. Listen, everyone who's listening to this, please take a lot of her advice to heart. You too can live a life. You can still have care for your patients and not feel guilty with that, but also sharing and doing what you can to help others, using social media and other technologies. So this is what we're doing here as we all kind of deliver and go through this path of where the new normal of healthcare is now. So thank you, Dr. Patel, and you have a great one.
Yeah, thank you so much for having me. I had a great time.